Getting the vaccine is one major challenge. Getting it to the people is another.
Getting those vaccines from an airport tarmac or a port to Canadians right across the country is a significant logistical challenge.
A challenge complicated by the need to store vaccines at extremely cold temperatures. Pfizer's has to be kept at -70. Already, the federal government has bought dozens of medical freezers to prepare.
Right now, we're just getting those things ready so that they can be situated in the area where the ultra cold vaccine will be deployed.
That deployment will be no easy task. Hospitals and public health are already stretched, so a nationwide supply chain has to be built.
That will involve multiple government agencies, possibly private contracts as well, may well involve the Canadian Armed Forces.
Specifically, the Canadian Armed Forces is assisting with the development of a logistics support plan for the rollout of the vaccine.
Vulnerable populations and frontline health workers get priority, but there's the question of how to share doses between provinces.
We've worked together on this so far, so it wouldn't be time to all split and run in our corners.
New Brunswick's premier says the country should ration initial doses like it did with PPE in the early days of the pandemic. Ask for what you need to protect the vulnerable, send the rest to the hot zones.
So the fewer hot zones there are in places that we're traveling, the less exposure we have in our communities here in New Brunswick.
If the vaccines get approved and arrive on time, the Public Health Agency says vaccinations could start in January. If all goes well, the vast majority of the Canadian population could be vaccinated by the end of next year. David Cochran, CBC News, Ottawa.